Linda Curran, your host for the Environmental Sensitivities Symposium, a world-first event, and today I have the pleasure of introducing you to Dr. Ellen Cutler. Hello, Dr. Ellen, how are you?
I am great. How are you?
Really, really good, and so excited to be talking to you today. Let's talk about the work that you do. What is it that you do, please?
I developed a system many, many years ago that deals with correcting sensitivities and or allergies, but I like to call it sensitivities because that's a broader term. And I use that therapy and this technique to optimize the well-being of people and rejuvenate them. It's anti-aging, as well as, of course, looking at and focusing on many different health challenges that many doctors see in their office every day, anywhere from asthma to menopausal problems and pain, arthritis, and just overall fatigue and headaches, and, of course, the variety of different digestive problems. And it's an amazing system because it really is very synergistic with what I put with it. It all works together, and it includes using digestive enzymes to optimize digestive health as well as supporting detoxification. I think that's probably why I am so excited to be with you today and talk about how I go about supporting detoxification, which is an ongoing process, as we all know.
And how is it that you came to do this amazing work?
It's evolved over time. I'm a chiropractor. I also have a medical degree. But it all started, and my books talk about my crazy story. I was diagnosed with ulcerative colitis when I was in my professional training, and I had all the worst symptoms of digestive problems, and I couldn't eat anything. I think I lived on grapes for months and months. That's all I could eat. Over time, my work evolved because I was naturally oriented and I didn't want to do the standard medical approach of taking medicines and surgeries, etc. So I searched out other ways to help myself, and nothing really worked. The only thing that made a difference, that changed my life forever, was I started a digestive enzyme. And at that time, and we're talking like 35 years ago, no, it wasn't on the radar at all. No one knew what an enzyme or digestive enzyme was. 2 weeks after I took that one digestive enzyme with every meal, I never had problems again. And then I evolved into looking at food sensitivities and other environmental sensitivities. And there is not a person walking on this planet that doesn't suffer sensitivities, which are reactivities, reacting to things which could be anything. You could react to a thought, you could react to a person, and of course, most people have sensitivities to most of the foods that they're eating, and that causes all the different health challenges that their doctors can't find remedies for.
It's an incredible story. So you basically, within 2 weeks, turned around what you were experiencing.
It changed my life forever. And from then on, I became so passionate about food allergies, food sensitivities, and digestive enzymes. And I wrote a book called Micro Miracles just on enzymes, the miracle of enzymes. Because if there's one supplement that people should take, first and foremost should be the digestive enzyme.
And why do you say that? Why is that the number one?
Because when you don't break down the food, you can spend tons of money and go to the best places to get your food. But if you're eating food and you're not breaking down and utilizing, absorbing those nutrients, your body is going to suffer. And it's going to suffer allergies, it's going to suffer deficiencies, it's going to suffer reactivities, because undigested food just gets into the bloodstream. And we have these leaky guts from poor health over time. Most people have that, especially if you have some kind of a chronic disease, which means things can leak from the small intestine into the blood. And you can get all these symptoms, like how many people out there, especially women, talk about being bloated all the time. I've been in practice over 30 years, and people come from all over the world to see me, or I Skype with them too. I do that as well. And I think if I can pick one symptom that is so common with, even if they come in with fibromyalgia, they come in with arthritis pain, they bloat, or they don't digest their food, or they don't feel well after they eat. How many times do we hear that? Just listen to a conversation of a group of people, especially women getting together, and they talk about their digestive ills. That is a result of not digesting your food. Just sometimes taking a digestive enzyme that's so simple can change people's lives. It's remarkable.
It's lovely to hear that it can be so simple.
It does not have to be complicated. We get so complicated. And it's not that I'm not all for some of these other supplements, but, sometimes I look at my patients and I say, if you're not digesting the food, how are you going to break down these supplements you're taking? We spend so much money on some of these, and they all sound so interesting and so amazing and so miraculous, but if you can't even break down your food and utilize those nutrients, it's not going to do what you think that supplement will do. And that's why you always hear people say, well, I tried that, but it didn't work for me. There's so many things that you need to do first. And first and foremost is digest that food and help your body optimize the food you're taking by absorbing all the nutrients.
Just makes so much sense. One of the other issues that I have with supplements is predominantly they're made in a lab, so they're chemical anyway. And so say people who've got chemical sensitivities, there's not really much point in taking more chemicals, particularly because they're struggling with detoxing them anyway.
Oh, I could spend hours just talking to you about all of that. In fact, just a quick story. There's a supplement that some doctor has been raving about, and one of my patients bought 4 bottles of them. Longevity, it's going to change your life. Everything you've ever heard of is in this supplement. And she brought it in, and I do a very unique testing, which we'll talk about. And the testing is remarkable. And she was having these reactions and rashes on her face. And I said, you know what? I found pesticides. And, of course, the product wasn't organic. And the doctor that recommends this product is all raw and organic and all that. And first of all, the product wasn't organic, and then even if it maybe some of it is, who knows what is contaminated, what's not? Isn't that interesting? And and I actually wrote them and asked them. I said, did you look into this product? Because maybe there's some things there that were gotten from some other countries that maybe had some pesticides. Because if you are environmentally sensitive, and most people come to see me are, you can lick, or you can just have a teeny bit of a pesticide, you will react to that. Or if it's a little chemical, you will react. So it's important for people to understand that, because some people think they're crazy. Why am I so reactive and so is not, Some people are so sensitive. I'm one of those people, so I am so empathetic with what other people go through environmentally. So I understand completely.
It's lovely to hear, because I think that really does make a difference. When you're suffering and you do feel like you may be going crazy, and often other practitioners will tell you it is all in your head, to then find someone like yourself who really understands, because you've been there. You get it.
I know. Most important thing is to listen to these people. We know our bodies. Listen. Everything we say or everything our patients say is so important. And it's, for me, critical that I know it all, because that will serve in my ability to really help these people.
Oh, I agree, and that's so nice to hear. Could you tell us, Dr. Ellen, why is it that you're so passionate about the work that you do?
I think I was put on this planet to help people, because it's just been my life. 24/7, this is what I do. And the work is so unique that there's probably nobody that does this kind of thing out there, because it's a program that I developed with someone else that put it on an instrument that allows me to assess what is going on. The unique aspect of our health is that it is unique. So, we classify these names, so, for example, fibromyalgia. So if someone comes in for fibromyalgia, two people, they're the factors that are contributing to them being diagnosed are totally different. So what my work does is it's tailored towards the person itself, not just the disease. So I don't treat a disease, I treat the person. And that's really, really important. And, for example, somebody could be sensitive to electromagnetic radiation, and some people not. And that could be contributing to their fibromyalgia or to chronic fatigue or to headaches. So in my work, and I do teach it, and it's called Ellen Cutler method. That's my new evolved work now. And you can actually evaluate what is really contributing to their symptoms. It could be foods, which it usually is. It could be things they're inhaling. It could be things they're toxic to or touching. Or it could be even bacteria. You can be sensitive to bacteria, even the good bacteria. All this goes into my assessment, and then I have a very unique way of actually correcting those reactivities so that you can eat those foods or you can come in contact and not have reactions and not have the symptoms that you have been having for years and years. So it's amazing how it works. It's successful. People really do well. And I can even work with people via Skype. I've managed to do that so that people who do live far away don't have to come see me if they can't make that trip.
And one thing I wanted to ask you, you said that you feel like you're here on this planet to be helping people. And it just made me wonder, what were you doing when you were a little person? I'm sure you were doing something like this.
Well, it's funny because my father always said, Ellen, you should do something with your hands because you got great hands. Because I was a chiropractor first, I used to adjust him when I was younger too. I think I've always been very focused and always very aware of foods. So even very, very young, I became so interested in nutrition and health. In fact, when I was really young, before I even went to chiropractic school, I studied with Dr. Bernard Jensen, who's an old nutritionist. Some of you might know his work, and I actually spent time on his farm down in Southern California and actually would dictate his talks and send them out and work for him. And so I spent a lot of time learning about what he did. So I think he was my inspiration to get involved because he lived what he preached. And that's the kind of way I am. I do and teach. And some practitioners don't do that, but I absolutely do. And I really benefited from spending that time with him. He was definitely one of my mentors. So early on, I was involved with nutrition.
It's just such a remarkable tale. Thank you so much, Dr. Ellen. And everybody, Dr. Ellen will be a speaker at the Environmental Sensitivities Symposium. You can find out more at environmentalsensitivities-symposium.com.